Today I am going to be inserting a Foley catheter on my client. At this point I have raised the bed up to a working height, put the guardrail down, did pericare, and did hand care. I have my red biohazard bag at the end of the bed right here. The next thing I'm going to do is take my catheter kit, place it between the patient's legs. I will open away from me, making sure to pull out the flaps since this is going to be a sterile area. Make sure they don't flap back. Okay, and then I'm going to pinch my gloves and put them on the table. I'm going to open my gloves away from me. Open up this package. As I'm opening the gloves, I want to make sure that the edges are not going to flap back over because that makes them unsterile. I'm going to get all the creases out. Okay, I'm going to pinch the inside cuff. As I put this glove on, and I'm going to leave it, and I'm going to slide this hand under the cuff of the next hand, put my hand in, and leave it like that. At this point, I need to make sure I keep my hands above my waist so that they remain sterile. Next, I'm going to begin creating more of a sterile environment in which to drape my patient. So I'm going to get this pad. I'm going to put the blue shiny side down and the softer side up towards my patient. I'm going to get this white one and place it like this. Next, I'm going to set up my area and get everything ready. Whenever I throw trash away, I'm going to pull towards me and then drop into the bag. So I'll open my alcohol swabs, away and in. Put these in the kit. I'm going to reposition my kit so I have room. I'm going to put the lube into my tray. I'm going to carefully uncover my catheter, making sure that it does not go out of the sterile boundary. I'm going to set this in the lube so it stays there. And I will get my syringe ready to fill up the balloon on the catheter. At this point, I will choose one hand to make unsterile so that I can open the labia while cleaning the area. So I'll open this. I will go from clean to dirty, so top to bottom through the middle. Pour towards me and drop into the trash. Go from clean to dirty far away. Pull towards me, drop into the trash. And lastly, the closest one towards me. At this point, I will pick up my catheter that is all covered in lube. I will carefully put this in directly into my patient's urethra. I will put it in 3 to 4 inches or until I see any urine. At that point, I'm going to insert the balloon, fill the balloon. And after I fill the balloon, I'm going to make sure I document how many cc's of fluid I put in there. So this one was 10, so I would document 10 cc's. I would also document the size of the French that I use for the next nurse that goes to take it off. So at this point, I would take everything off. I'm not going to do that because I still need to use that. But then I will secure the bag to a non-movable part of the bed. And then I will tape this to her leg and leave in some slack. Yeah, so I would tape that. And then to remove the catheter, well, after I've hung the bed and everything, I would clean everything up, throw it in the trash, and I could remove my gloves at that point. Get that out of the way. Okay. So then to go to remove the catheter, again, I would check the documentation to see how many cc's of fluid are in the balloon. I would take my syringe and deflate the balloon. If you pop it in, it should deflate itself. You want to make sure you have the full amount that was documented, which it looks like we do, 10 milliliters. And then we would slowly pull this out and discard everything.